but stress can also be negative. In other words, can have a negative impact on you. I'm sure we're going to hear a lot more. I know that when we come to ECU as students, there are times of stress, especially when it's times of exams or when we're looking for tuition fees and the fees are not there. How do we manage? How do we handle ourselves during such times? And I believe today we are going to hear from Mrs. Ruth Senyonyi on managing stress. So let's pray. Father in heaven, we want to thank you that once again we are gathered here to learn from you as we speak through Canon Dr. Ruth Senyonyi. We want to pray, Lord, that you will use her and that you use her effectively. We pray that her thoughts and her expressions will be your own thoughts and expressions, and that she'll be able to communicate that which is from you, and that by hearing and learning from her, we shall be able to manage stress, which is something which occurs now and then in our lives. We want to pray, Lord, that many people join on. We want to pray that our gadgets will work well. We want to pray that also the internet will hold, and that this will be not only a knowledge session, but also something we shall be able to put in practice. We pray all this in the name of our Lord Jesus Christ. Amen. So the time is 3 minutes past 8. Canon Dr. Ruth Senyonyi is in the house. And so I want to welcome you, Dr. Ruth Senyonyi, to speak to us.
Thank you very much, Dr. Professor. I'm glad to be here today, and Reverend Senyonyi is also in the other room, and if he has any contribution, he will surely add it. But we are happy to be here this evening. Thank you for the prayer. Today's topic is stress management, and I think I like talking about stress management because many of us are stressed, and sometimes you don't know exactly how to deal with the stress. Sometimes we don't even know how to identify it, or we don't know what it is. But we feel tired, or we feel sick, or we feel, and we don't know exactly what it is. So today we want to be able to manage what we know, because you can't manage what you don't know. And many people don't know. So today is a learning lesson, and I hope you enjoy it. Stress management. Let me first begin by trying to describe what stress is. Stress is the body's response to any kind of threat or demand. We have what they call the fight or flight mode. It's like when there is a threat to the body, the way it defends itself, it has an automatic process that comes, and that is known as the fight or flight, so that the person either runs away or fights whatever it is that is coming. And many times I use a little mouse. I am so scared of little mice, small as they may be. And you can see in that picture, he's not raveled, he's just standing there, but he's making this guy stand up on a chair. So sometimes any demand that makes our body want to run away, the body automatically responds. And this is how it responds. It responds by releasing chemicals. And I think as people working in the medical field, you know that glucose and adrenaline are thrown into the blood system so that you can get enough energy and strength to either run away or fight. So there's an increased blood supply to the heart, an increased muscle, the muscles strengthen, and then the high pressure is also elevated. Digestion is slowed down, and therefore sugar is dumped into the bloodstream to also serve as energy. So it's like they're getting energy reserves from everywhere. Muscles also become very tense and they're ready for action, because if you are on a running line and they tell you get ready, set, go, automatically your muscles strengthen and become tense because they are ready to run. So this is exactly what happens in the body. And many times you are not even aware that it's happening. It's an automatic response. And so the fight or flight response does many things inside the body, as you can see there. The saliva flow decreases, the eyes, the eyes in the pupils dilate, the blood vessels constrict, there's chills and sweating, the heart beats faster and harder, the lungs are quick, deep breathing, the food movement slows down, the blood pressure increases as the major vessels dilate, and then the stomach output of digestive enzymes decreases, and then the muscles become tense. So everything is touched. Now, there are different types of stresses, and we need all these types. So, but however, the body sometimes doesn't know which kind of stress it is doing. So the first type is called the positive or necessary stress. It is good stress. So we must have stress. Like now, for now, as I'm doing this presentation, I need that energy to do this presentation for this hour. So this acts as a motivator and an energizer. It helps me to stay focused. It helps you as you are listening to me to be energetic and also to be alert. It gives ability to achieve a high level of performance. So good necessary stress is type number 1. Very important. So it is necessary for what? For growth, for change, for development, for performance in daily life. I have to grow. I have to meet changes. Maybe I'm in the traffic. So it adds anticipation and excitement to life. And we all thrive under a certain amount of stress. So this is good stress. We need this stress. We need to have it, because if you don't have it, you'll see, then you have the type 2, which is insufficient stress. Insufficient means that there is nothing motivating me. And so it may act as a depressant and leaves me feeling bored, dejected, and not up to full potential, because what? Nothing has come for me to be motivated. So that's why you find people stay in bed. They don't want to get up because they don't have sufficient stress. There's no motivation to move you into responsibility. The next type is what they call excessive. Now it is too much and maybe too long on the body. So constant or continuing stress affects the health and behavior of an individual. A steroid hormone called cortisol is produced in response to this kind of stress, and it raises the blood sugar levels and is dangerous in chronic levels. So before it was released like you are ready to run from the rat, and now it is not going. So the stress level is at the same level. It's just continuing high, it's not coming down at all. So it leads to helplessness and hopelessness. So that these two types, the excessive and the insufficient, make you feel helpless and hopeless. And then the type that we need is what they call optimal stress. What we need is optimal stress so that we are motivated and we are not overwhelmed. So if you are experiencing stress symptoms, as we shall see later, it means that you have gone beyond your optimal stress levels. So stress in the modern world, however, is also different, because as I told you, if there's a rat, you see the rat and you jump up on the chair. But you know, the stress now that we get is not identifiable. For example, your body can respond to a psychological rather than a physical threat. Say you are caring for a chronically ill parent. The stress you get is not the same as the one you saw with a rat. You don't see it. You are taking care of your parent every single day, and eventually the stress is there, but you don't know. Or a fiance who needs attention. I think you've seen or you've been with friends who, why didn't you call me? Who say, why didn't you call me? You're supposed to call me every 2 hours. You're supposed to keep up with me. You're supposed to take care of my psychological, there are people like that. And you're like, look, I don't want to do that. Or in traffic jam or staying home in COVID-19. So these things do not call for either fight or flight, but the body cannot make a distinction. So it activates the stress response. I hope you understand that. So that's stress in the modern world. Sometimes it is, I have been on my phone for so long. The phone is ringing, I'm answering. That is stressful, yet it is not a threat to you. But your body is now reacting like that. The more stress is activated, the harder it is to shut it off. Instead of leveling off after the crisis has passed, the stress hormones, the heart rate, and the blood pressure remain elevated. And the extended or repeated activation of the stress response increases diseases like heart diseases, anxiety, depression, memory problems. So it creates more problems. And sometimes I illustrate it with a rubber band. Right now, I don't think I have access to a rubber band. But if you have a rubber band, this is how it works. Imagine that I have a rubber band that I've stretched out now. When I let it go, it pulls back by itself. We pull it, it pulls back by itself. Pull it, back by it. Yeah? And that's how our body is supposed to run. It's supposed to have what they call the homeostasis. Okay, you pull and it goes back to the most ideal situation. It goes back. That's how the body is supposed to work. So any demand, internal, external, that upsets that balance. It pulls like the rubber band, as you can see in the picture, and pulls and pulls and pulls and pulls. And if you pull a rubber band and pull it, what happens? It breaks. So that's what happens to our body. The demands are too much on it. Sometimes the threats we can see, sometimes the threats we can't see, because in the modern world, the threats we can't see, and they pull on you until your body gives up and breaks down. So we don't want to do that. We must be able to return to the most ideal situation. And when we say managing stress, that means we are going back to the ideal situation where our body is not feeling the stress, the long-term stress, or is not actually being activated at all, but we are back to the optimal that we do want to experience. So there are three major stressors. The first area is what we call the major life changes. Anything that is major, that changes in your life, can cause stress. And then secondly, daily demands. And then thirdly, internal causes. So we are going to run through them. The first area is the major life changes. What is happening? Maybe I've moved into university from high school. Maybe I've moved into a new home. Those are life change stressors. Maybe I have now gotten married, or maybe I am divorced, or I'm going into a remarriage. Maybe I am going into retirement, or there are signs of aging. Or maybe I have moved from America to Mombasa, different kind of atmosphere, different kind of weather. Maybe I have been transferred from this job. Maybe I'm going through menopause, or maybe I've lost a loved one, or being fired from a job. All those are called major life changes. That you could add more, definitely, but they cause stress. The second area of stress is what we call the daily demand stressors, and can be caused by the environment. Maybe there is an unsafe neighborhood. Maybe there is pollution. Maybe there are terrorists. Maybe there is noise or crime or time pressure or even competition. So the environment, I put that picture of a soldier because it portrays the unsafe neighborhood. If you have, I remember in one of the villages where my mom lives, they have been having people who have pangas who come at night and start banging at doors and cutting up people. So that has happened in some areas. Now, if you live in a neighborhood like that, your heart is always racing and ready to run. So it's not really nice to be in such an environment. Another daily demand stressor is to do with family and the relationships you have around you. So marriage can cause stress because you are expected to always be looking out for each other, husband and wife, and maybe your children. Parenting, how you are relating with your children. Romance, you are expecting your spouse to be romantic and they are not being romantic, and what is happening there. Couple conflicts, domestic violence, caring for a chronically ill family member or a child with special needs. When a child is sick, maybe for many years, sometimes you can have chronic stress as a result of that. And then another daily stressor, which is common with all of you who are studying, is to do with academic stress. I don't think I'll go back to school again because it was very stressful. Exams, I would have nightmares about exams whenever it was around exam time. Coursework and course load, deadlines for assignments, scholarship pressures. Am I getting a scholarship? Do I have enough fees? Lecturer stress. By the way, even the lecturers, because I'm a lecturer, they also get stressed by marking and looking out for the students. Classroom competition. I remember one client of mine told me, I'm always competing with two people in the class to make sure that I have more marks than them. So that is enough to make you stressed. Making the grades or passing, academic performance, how am I doing? I want to get a first class, and then you lose out on 2 or 3 marks. Time management, all that is under academic stress. Another daily demand stressor is to do with work. Maybe you are dissatisfied with a job, maybe you have an exhausting workload, maybe you have a low pay, politics at work, conflicts with what we call absent or slow staff. They're supposed to work, then they don't come that day. You're supposed to do their work, or because you have a deadline, you are giving in some things, you are working as a team. This person is not concerned at all. So those are daily demand stressors. Another area of daily demand stressor is social. In terms of money, financial pressures, tribal, sexual discrimination, isolation, lack of social support. By the way, lack of social support is a big stressor. I remember I always talk about this lady. She she was sick, but she didn't have anyone to take care of her in the hospital. She was in ICU. No one except us at work would come and drop in on her, but she didn't have any kind of social support. So lack of friends, social phobia, you are scared of going out in the social world, loneliness as a leader, social distance, all those are what we call daily demands. They fall under that category. If you remember, I've talked about the 3 areas. The first one is the major life changes, and now it's daily demands. And the third one is to do with internal causes, internal stress. So being worried, sometimes you can't see, worrying, your head is criticizing you, a terrible person, you're an ugly person, you can't make it, you are not good enough. Low self-esteem. I think we've talked about esteem and how to identify the low self-esteem and how to be able to live up to what you can do. Excessive anger or unexpressed anger, all those can cause stress. When I talk about anger, You should be able to understand how your body reacts to anger. When you are angry or when you are not fine, what happens to you? And then lack of assertiveness, and then perfectionism. Some people think, oh, perfectionism is okay, but perfectionism can actually be can cause you a lot of stress because it's very demanding on the body. So that is causes. Now, when we go to the stress symptoms, we have also different areas of stress warnings and symptoms. The first one is emotional. You become moody, you are restless, short temper, you are feeling tense, you are lonely, depressed, you feel even hostile. You are hostile to everybody. Why are you asking me? You want to isolate yourself. The second area is to do with the cognitive, that is the thinking. So you have memory problems, you are indecisive, you don't have the ability to concentrate, you are constantly worrying, you lose objectivity. Someone tells you something and you blow off your mind. You are not thinking, you're not using your thinking capacity. You have fearful anticipation, you are pessimist, you have poor judgment, and you have racing thoughts. All that comes through as cognitive. And then the health is also affected. 60% to 90% of all illnesses are stress related. As doctors, as people who work in the medical field, I'm sure you know that people come and say, I'm feeling sick, and you take all the vitals, nothing is there. So sometimes that is to do with stress. Because stress does a lot of things. The immune system is suppressed, and then it compromises the ability to fight diseases and infection. So stress also upsets the digestive system. Remember, I told you that when the digestion stops, so that energy goes into the body, so it upsets the digestive system. It also makes it difficult to conceive a baby. So many times when people are coming over for counseling and say we haven't conceived in the last 3 years, 4, 5 years, we say maybe it's to do with stress if we have ruled out everything else. So physically, when these are the stress symptoms: headaches and backaches, muscle tensions and stiffness, diarrhea or constipation, insomnia or lack of sleep, then nausea, dizziness, weight gain or loss of weight, skin breakouts. Sometimes you have all these things breaking out on you and you don't know why, loss of sex drive, chest pain, spinal cord pain, and low immunity. All those are physical. Other physical conditions also caused by stress: chronic pain, migraines, ulcers, heartburn, high blood pressure, heart disease, PMS, obesity, infertility, diabetes, asthma, food intolerance. And then we go to the behavioral. The symptoms are the following: eating more or eating less, sleeping too much or sleeping too little. Isolation comes up again. Procrastination, where you don't want to do things, you keep putting them off. Nervous habits, like you are maybe you are doing your hands like this, or pulling your ear, or pulling your hair, or tapping your foot. Grinding teeth, overdoing activities, overreacting, use of alcohol and drugs to relax. So a little table here from the internet just shows you what I've been talking about. The body is affected, the mind is affected, the emotions are affected, the behavior is affected. And that's a whole lot of affection that has come as a result of stress. So then the next question we ask, so what do we do now? What should I do now? I like this little cartoon. It says, I'm a little stressed right now. Just turn around and leave quietly and no one gets hurt. I'm sure you've been in those kind of situations where you want nobody in your sight. You just want to be alone because you are stressed. Everybody's stressing you. Maybe they want the report from work. Maybe they want the report from school. Maybe your children want money for school and you are stressed. So what should we do? And that's what we call management of stress. So stress management is the ability to maintain control of what we call a homeostatic balance when situations and people make excessive demands. So that demands will always be there. Daily demands, long-term demands, internal stressors. But how are we able to maintain that homeostatic balance? Thinking of of our stretching rubber band. We stretch, we do what we have to do, but it has to go back to normal. So that is the balance. You pull back and forth like that. That's how the body is supposed to work. So stress management is the ability to control that, to maintain that control. It stretches, comes back, stretches, comes back. You need to be able to improve your ability to manage stress in your life. So the first thing in managing stress, you have to be aware. Beware of whatever causes your stress. Is it daily demands? Is it internal stress? Is it changes in your life? What is going on? You know, you are retiring maybe, or you have an exam. Say, okay, I have an exam. That is why I am stressed. Then you think of, how am I reacting to this thing that I've become aware of? So you think through what's happening to your body physically, what's happening to your body emotionally, what's happening to your cognitive, how are you reacting? Like the things I have just said before. So write those stressors down. Can I change the stressor? Can I avoid it? Can I eliminate it completely? Sometimes you can be able to do that. Like the rat, you can eliminate it by killing it and it won't come back again. Make sure you have closed all the holes where it passed. Make sure you have a trap or something. So you have eliminated. You won't see the rat again. You will not jump on the chair again. But there are some things which you cannot get rid of. So you reduce their intensity toward you or shorten your exposure to them. If it is your husband or your wife who is giving you trouble, then walk away, go to the kitchen, do something for about an hour. Take a walk around the house, beat the pillow 100 times, with your fist, and then settle down. Can you remove yourself from the stressful situation? If you can, it's even better to do that. So be able to recognize the stressors and do something about it. Another tip is you need to be able to manage your time, because time management improves stress management. So get organized, set your priorities, stay focused, don't multitask too much. Some people over multitask. They are doing this, they are also doing their assignment, they're also talking to their friends. We hear you sometimes when we are presenting like this and you are on something totally different. You are talking about how you are in one day and you are coming back. You are on this call, you are not concentrating. So even as we multitask wisely. Identify those things that waste your time and learn to be a person that says no and affirm no. I'm not coming. I'm not going to do that at all. Prioritize. What should I do first? What should I do next? What shouldn't I do today? Journal. You need to write down some of the things that you are doing or you are going to do. Maybe you need a to-do list, This is what I'm doing today. And tick off, tick off, tick off, and then push this to tomorrow. You need to have a diary that is working. Slow down. Eliminate hurry in your life. Some people are hurrying every single moment of their life. They're hurrying, hurrying, hurrying. Driving, they're hurrying. They're hurrying. Remove hurry from your agenda and slow down so that you manage your time well. Academic performance, you need to avoid procrastination. That's one of the things that I did in my PhD, particularly I remember so well, because I was so busy. There were so many things I was doing. I was working at the same time. Many of you are probably also working as you are going to school. So just know, what is the date of the assignment? When am I supposed to submit that assignment? If it is on Friday, I will sit up all night and make sure that I submit on time. Let it be one of the things you do in your academic life, submitting things on time. And I remember when I was teaching, I think I was teaching at UCU, and I would tell them that assignment, you're supposed to give it in on this day by midnight. So of course they send it on mail, and I see that the person has sent it in the morning the next day instead of midnight the day before. And I don't even open it, I just delete, because I told you deadline is this. So I had no tolerance at all for people who are submitting late work. And that helped many people to catch up. I know it sounds cruel, but that helped many people. They knew that I would not look at work that came in late, and they would lose marks on that. Use the available resources to get the help you need. There are e-libraries. Don't be afraid of using e-libraries, books and lecturers. Ask. Stay present and focused. Learn new skills. Accept your mistakes and reform. If the teacher has said, do this again, just listen to them and do it in the way that they seem fit. Right now, they are the ones in charge, even if you think you know more than them. Avoid wasting time in useless activities, and then learn to simplify your tasks. Learn to do things faster than before. If you need a new route going to school, if you need to wake up earlier, if you need to, and then also make the environment that you stay in look nice and neat. Free yourself from work, that's another one. Workplace has work and it ends at a certain time. Even if it doesn't say so, you create those boundaries where you say, work has stopped now. Now I'm at home. So have those boundaries clearly. End the workday consciously and deliberately, and reduce your accessibility to your workplace. So create that boundary. Then physical activity is another thing that works off stress. Build more physical activities into your work, into your crowded life, and help to burn the extra chemicals so that the body can be able to return to normal. So you aim for at least 30 minutes a day, for 5 days a week, 5 to 6 days a week to work out. You can go alone, or you can get an exercise buddy. You can also do it in front of the television. There are so many exercises that can come up there. That is good. Another area is to unplug. Switch off your phone. Switch off your emails. Switch off the notifications, because sometimes when you live on a phone, even as you hear it now, every time it does do 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 do, you see what is that. So your mind is always disrupted, and so it is always working. It is stressed because of that. So notifications at night, some people switch off their phones at 8 p.m., wake up at 8 a.m., put it on again. Have some kind of unplugging that you do for your gadgets. Avoid being reactionary, because many times when we have gadgets, we react. Somebody's calling you, it's at their time, not your time, and you want to pick up every time a phone rings. You want to pick it up because you are reacting. You are not thinking of, I'm not ready to pick up a phone, so let me put it on silent. I'm not picking phones for the next 3 hours. It is well. The person who calls will call again. If they are really in need, they will send a message. And by the time you go back after 3 hours, you will find the message, and they will not have died. They will be fine. As my daughter usually says, they are going to be fine. So when you are going to sleep at night, wind down and shut down. Whenever I talk about stress management, I talk about my sons watching Prison Break, and what is the other one? I keep forgetting what it is. Something about a president that is killing people every minute. Now you can't go to sleep after watching Prison Break, because your mind is racing. Your mind has already been, it's like they were chasing after you. So winding down means you are going to wind down and bring things into your life that are not going to make your heart race, so that you are able to sleep. Then excuse yourself from useless activities like gossip, endless meetings, things like that, that don't make sense. So useless activity, learn to identify them. Another thing is to get enough sleep. You need 8 hours of restful sleep. So avoid alcohol, avoid caffeine, avoid nicotine, avoid rock boom, avoid those energy drinks, especially near bedtime. Avoid distractions and like noise and light when you are sleeping. And you can also take a nap during the day. A 10-minute nap. Put your head back, sleep, deep sleep for 10 minutes. And then also getting to sleep at the same time every day helps your body to get back that homeostatic balance. I hope I'm saying the word the right way. So pull it, push it back at night. Take a nap, it pulls it back to normal. Healthy diet, eat lots of fruits, eat vegetables, eat whole grains, less sugar, no red meat, no processed foods, no saturated fats, no alcohol, no drugs. Avoid self-medication. Get a headache and you're like, oh, I'm in medical. Let me just buy some medicine. Avoid those kind of things. Maintaining a good attitude. So focus on the positive. Laugh a lot is a positive emotion. So humor addresses stressful circumstances. Smile and laugh a lot. Share your feelings with a trusted friend. There are things we call non-essentials. Let them go. If someone has hurt you, let it go. Don't focus on it. Then we have relaxation techniques to reduce muscle tension. Right now, if you are able to feel yourself, I'm sure you have tension in your shoulders. So if I told you, relax, immediately your shoulders drop and relax. So I'm going to teach you one relaxation technique. Okay? Maybe one or two. You breathe through your nose, you hold it, and then you are going to breathe out slowly, counting up to 10. You breathe in through your nose, you hold it, and then you start breathing out through the mouth slowly, slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So by 10, the breath you had taken in is all out. So you hold and then let go. You hold and then let out. You hold, and you do that many times, especially when you are now more aware of when your body is not relaxed. So become more aware of that. And when you feel like that, whether you're in a taxi, whether you're at your desk at work, whether you are in church, whether you are in your bed going to sleep, that exercise is very easy. And then another one is you take yourself to a place that you like. Let's say you like your bed. So in your mind, you take yourself there. If you like being near the ocean, or maybe you like being in jam. I don't know if anybody likes being in jam, but take yourself to that place where you feel relaxed. Maybe you like sitting outside that tree, under a tree, a banana tree or a mango tree. When I was doing my PhD, I used to envy people that would be sitting on a mat outside in the sun. I would envy them. I said, I don't have time to sit there like that. So you take yourself there, you transport yourself there in your mind. So, as I said, when I say relax, your shoulders automatically go like this, they fall down. So now when we are there, we close our eyes and we start relaxing every part of our body beginning from the top. So we begin with the forehead. When I say relax the forehead, you relax the forehead. Then I say relax the jaw. So you let the jaw down. Relax your neck. You can even do like this and you feel like your neck has relaxed. You relax your shoulder. You let it go. You can even put your arms down. Then you go down to the chest. You feel sometimes the chest is so tough and so hard. So you release it. Then you go down to your tummy. Many times as women, especially, we hold our tummies in to have that figure eight, that we call figure eight. This time you release it and the tummy comes out properly. That is, relax it. You go to the thighs, you go to the knees, you go down to the toes. And you do that several times until you feel very relaxed. We do this in workshops, and you find that people even go to sleep. So you can find yourself asleep as a result of that relaxation. So when you are aware of the stressors, then you can learn how to relax your body so that your body goes back into that balance of what I talked about with the rubber band. Since I can't see you, I don't know whether you have done those things, and I hope you have. Let me see if anybody. I hadn't opened my chat. Um, are you doing this? Someone is saying I have done it. Thank you. So that I'm not talking alone. Sometimes you can be on these things and you are really talking and nobody's listening. So I need some energy here that you are doing it and you are aware of what I'm saying. Thank you. Thank you. Even Professor has said I am. Okay, good. So take those home and be able to do those exercises. Then it's important to improve your relationships. Relationships is an area which sometimes brings a lot of stress. So communicate better, spend quality time with friends. Don't always be alone. Don't isolate yourself. Manage conflicts. Learn to say, I'm sorry. Go back and apologize to people who you have hurt. Manage those relationships. So go back and improve. Maybe it's your parents, maybe it's your boyfriend, maybe it's your girlfriend, maybe it's your roommate, you are totally stressed by what they do in the room. Pick up yourself and say, I'm sorry, you have stressed me. You put things in the wrong place. You are so untidy, but forgive me. Let me help you to be tidy. Then improve your work or job. So you may need to find a new career. Maybe you need to get busy somewhere else. Maybe you need to simplify your work. Some of us are doing so many things and we're taking so long to do them. Learn how to simplify things that you do. Be professional. Maybe it's reports and you take so long. You take 3 days doing a report. Have a template that makes it easier. Be professional. Make your workplace comfortable. Usually I used to tell people, get a flower. In beginning of the week, you get some roses, 3 roses, buy them from the street there. 3 roses and get a little vase and put them there in front of you. It will brighten up your space. After 1 month, 3 months, turn your desk around and face another direction. Turn your chair and look the other way, Put up pictures of your friends, of your husband in that room, Do something so that your workplace space is comfortable. Avoid bringing work home. Get a comfortable car. If you are in a car a long hours, get cushions, make it clean, have things like music that help you. Get air conditioning so that you're not sweating. I remember one time I was telling my colleague that Panang, it is so hot, and said, we should not be able to say that at all. Bank of Uganda gives you what? Air conditioning, and gives you money to buy a car, a loan to buy a car. You should be able to buy a car where you put on air conditioning. Stop telling us it is hot. I laughed. It was very funny. So some of these things, enjoy them while you are still alive. You have a car, make sure it has an air conditioning. You have a house, make sure it is clean. Okay? Get a job description to avoid ambiguity, because many times we are doing jobs and we yes, and there are role conflicts. Then delegation. Delegate your things. Trust others with your responsibilities. Maybe it's colleagues to do work-related tasks. Maybe it is family members. Don't have a family, 6 people in the house, and you are the mother, and you wake up and do breakfast, and you clean, and you cook, and yeah, distribute things and say, today you are cooking the rice, today you are cooking the beans, tomorrow they should be even written and put on the fridge, and knows what they are supposed to do. Get a house help to help with your house and with your children. Get a driver. Get a border guy who can run errands for you. Go there and get me some potatoes. Go there and get me some tomatoes. Reduce driving stress. And then your parents, maybe they're in Kabale and you are here in Kampala, or they're in Arua. Bring them closer when they are sick so that you can be able to manage them. And then also manage your emotions. Manage your anger. We shall be talking about anger management at some point. Forgive people. Avoid being reactionary. Avoid being violent. Someone tells you something and you want to beat them up. You respond so badly. The way you speak is not respectable. You should avoid that. Think through the things you are telling other people. Be slow to speak. Examine your cognitions, the things that injure you in the head that you are thinking about. Say, oh, I want to commit suicide. Oh, I want to get rid of myself. I am such a poor communicator. I am so, don't say those things to yourself. Your thoughts and patterns should be encouraging you to move on. Someone is asking if there are cheaper alternatives. Yes, there are cheaper alternatives. You can always find cheaper ways of doing things. If you don't have a car, you can walk in areas that don't have dust. If you're on a border, get a safe border. So there are always alternatives of doing things better. Sometimes you just need a good cry to manage your emotions. And then lastly, it's important to give God his place in your life. What your faith matters. Where is God? How often do you trust him? Recognize that he's the master planner, he's the controller of your life. Trust him. If you married someone, I had someone say that in a WhatsApp message. It says, if you married somebody and you think it's the wrong choice, there's nothing that you can really do about that. It's not like a course, like saying, oh, I took the wrong course, I'm going to throw that course aside, I'm going to take a new one. With a wife, a husband, you do not get a new one. Trust him that he's the one who gave you that husband, and things are going to be okay. Take time to reflect on his word, take time to pray to him, and God, as Mr. Peter Pio has said, is everything. Trust him and he will help you. I want to say thank you for listening to me. There's one more. Seek help, seek professional help in case of severe symptoms of stress. I don't want you to just think that because I've told you this, you should be okay. But if there are severe stresses, please, like depression, anxiety, panic attacks, insomnia, trauma, please seek help. You can seek help through counseling, through medical, through pastoral help. Thank you very much. And I hope you have a stress-free, I don't think you have a stress-free environment, but you need to know the stressors and you need to be able to manage them. God bless.